Martin Gomez is COO and co-founder at Dashlabs.ai. Hello, Martin. We're very happy to have you dito sa Startup Podcast.
Hi, good afternoon. Thank you for inviting. Salamat sa pag-uulak.
Yes, I'm actually very excited to learn more about Dashlabs because it's an AI-powered platform that's automating health and medical diagnostic lab process. So actually, it's a AI-powered health tech startup or med tech startup, you can call it like that. But I'm sure you can speak more to this. So ano nga ba, Martin, ang Dashlabs.ai?
Maraming salamat sa pagtatanong. Ang Dashlabs.ai, nagsimula kami bilang isang volunteer organization na nag uh, automate namin yung lab processes, no? The pandemic, that's where we created the lab software to automate the processes. Nagsimula kami sa pag-automate ng Philippine Red Cross, yung COVID-19 testing. At gumawa kami ng AI module para mapabilis yung kanilang pag-analyze ng mga samples para malaman kung yung positive or negative ba yung sample, tapos on a plate basis siya, tapos naka-batch. Tapos yung transportation rin, yung match niya, tapos yung sa isolation sites, yung paano mapabilis yung pag-release ng mga patients, yung mga ganun. So
Wow.
from there, yes, go ahead.
Yeah, it's actually amazing. I didn't know actually that Dashlabs.ai is actually like a COVID-19 baby. Kasi I mean,
Mm,
seeing right now like the amount of reach, like the amount of things that you have done, biglang ang daming na-achieve. Yes,
yeah.
maybe later we can know more about that story pero maybe puntahan muna natin yung kumbaga intricacy ng medical processes itong why in the first place there was a need like with Philippine Red Cross as you've mentioned may need kumbaga to automate these things, bakit ba siya mabagal? So let me
Yeah.
ask first like yung pinaka core nung problem. So
Sure.
before automation, before AI, before Dash Labs, so how are this done? Like how are these lab process? Bakit sila babagal? Ano ba yung parang inefficiencies? What I mean and what maybe saan pumasok si Dash Labs exactly to automate them to speed up the process?
Got it. Sure, no problem. So, Johnny, you and I travel a lot, no? And our favorite airport is of course Naiya. And if you remember, before COVID, pag maglaland ang bawat pasahero sa Naiya, kailangan mag-fill up ng isang form, di ba?
Physical form. Actually by pen,
By
by ball
hand.
pen. Yes.
Correct. Pen and paper, di ba? So may immigration form, tapos meron din yung BOQ quarantine form, tapos meron din iba't ibang form pa kung depende kung anong classification ng passenger. So just imagine that you have those, and then COVID, may additional forms pa. Meron ka pang ECIF na mahaba-haba. Tapos, so imagine mo, you have to fill that up, and then you have to get those forms processed and shipped and encoded in a central location. So ang nangyayari is yung mga may COVID na nauubuhan nila yung form.
Mm.
So yung COVID, yung virus nandun sa form, napupunta dun sa encoding center. So yung buong encoding center bagsak, 'di ba? So ano sila? Naka-quarantine sila ngayon.
Mm.
So that adds to the problem. So which is why during that time, passengers were stuck at the airport 5-6 hours, and then after they get out of the airport, they get stuck in quarantine sites for a few weeks to even months, 'di ba? Bago sila ma-release. So yun, so sabi namin, hindi to pwede, 'di ba? So nag-reach out yung PRC, sabi nila, tignan nyo nga, baka may pwede kayong may tulong. Kasi at that time, ang ginagawa pa na, we were a volunteer organization that we were just mapping out the routes of, let's say, shuttles for healthcare workers and then open establishments, yung mga ganon. We were still called Dashboard Philippines back then. And then, nung tinignan namin yung proseso, sabi namin, yung maitutulong namin hindi lang dapat nandun sa process, dun sa high level process. Ang talagang i-improve namin dun sa buong proseso ay dun sa pinaka-core, dun sa pinaka-lab medical process itself. That's why pinasok namin dun yung mga lab mismo, yung testing, all the way to the biocabinet, all the way to the RNA extraction, all the way to para talagang ma-improve yung buong proseso. Kasi yun ka, di ba? If you want to improve something, you have to you get your hands dirty, or else you won't be able to you can't be sitting in an ivory tower, right?
Yes. First of all, I like to comment on the NAIA on the airport. Actually, that's very true. Actually, nagtataka nga ako kasi like in other airports, like in other countries, actually wala or less or wala gumagamit nung by hand
Papel.
na pa na
Mm.
form. So it's usually online and it's usually like nakikip na yung data and nare-reuse siya. And using that analogy to the medical industry to the medical labs. So is it the same na parang they still kumbaga pag-transfer ng data, pag-transfer ng information is also still physical before you came kumbaga to automate them. Is that right?
Yes, correct. So if you go to clinics, laboratories, even hospitals, no, you will see huge filing cabinets in stock rooms where you have the medical records, which is even up to now, right? You go to even some of the big hospitals, you will still see them. Let's say pag nagpa-X-ray ka, sasabihin na, you come back tomorrow and then they get your film. Diba?
Yeah.
Imbis na yung digital file ibigay sa iyo or ilagay din sa isang platform where your doctor can already put in the findings as well, apart from the impressions of the radiologist, rad tech or radiologist.
Yes. Yes. That's such a pain. Actually, I remember when I'm in Taiwan actually right now. I've been living here for
Mm.
4 years. And actually, I'd like to comment lang din na dito kasi sa Taiwan, we have the NHI, National Health Insurance, and merong card
Yes.
siya. Kumbaga ano na yung sa card na yun, may chip siya and it can actually like with that chip, you can store yung medical data and magagamit mo sa kahit saang hospital, kahit saang lab, kahit saang clinic, kumbaga ano na
Yes.
yung data. I remember back then when I was applying nung to immigrate to Taiwan from in the Philippines. Ang tagal kong nasa nagte-take ng medical exam. And yes, that's true. May mga pinifilipan pa akong form na parang paulit-ulit na
Yes.
when you come to think of it, pwede ngang baka ma-store nga lang sa isang database and ma-reuse to different clinics, to different labs, to different hospitals.
Correct.
But on the side of so because you offer this product, this service to like these clinics, this lab. So like in their perspective, what do they see? Parang how is it for them? How did it also like alleviate or make their job easier in their perspective on their side?
So yun, napapadali yung trabaho nila, di ba? Kasi imbis na meron silang army of, let's say, encoders, wala, hindi na kailangan nun, di ba? Kasi isipin mo, how many head count yon, di ba? Tapos yung operations, yung overhead cost. Tapos yung dignity pa ng tao. Isipin mo nag-aaral ka medtech, tapos licensed ka, tapos ang gagawin mo lang mag-encode ka ng patient data,
True.
di ba? So imbes na ganun, yun, we were able to shift those headcount to from outside the laboratory to inside the laboratory where they can actually do the tasks that they were trained and they actually studied to and licensed to do.
And it's actually not speed. So actually in your website nakalagay 20 times speed increase and
Mm-hmm.
99.99% accuracy. It's also accuracy because like
Yes,
when manual ang paggawa ng encoding, baka medyo prone to human error,
correct.
typos, ganyan. But with kung naka-encode na siya and i-transfer mo information, walang room for any mistakes like that. Um,
Yes.
it's very nice to hear like this automation kumbaga nung flow ng information. And just to clarify, right now you're focusing on medical diagnostic labs. Can we know lang this exactly? I mean, who are these X-rays? I mean, who
Sure.
are these labs exactly in the Philippines?
Sure. So there are quite a number of laboratories, no. So what happens is that traditionally these exams are done in hospitals, right? Kasi once you go to a hospital, may sakit ako, doc, kailangan ko yatang malaman kung anong nangyayari sa loob ng aking katawan. So you do your blood extraction and all these things. Uh, a lot of times, sobrang daming nangyayari So hindi kaya nung lab. So ang ginagawa nung hospital labs, nagsisend out sila to these
Other
independent
lab.
laboratories. So that's one option. The other option is outpatient, right? Hindi naman ako confined ang ano tapos right now 'di ba marami tayong mga teleconsult ganon. So ay hindi naman ako restricted na gamitin yung laboratory ng hospital mismo where the doctor is affiliated. So therefore, I go to these independent clinics and laboratories to get my health basically checked in order for me to be able to send to my doctor whatever is going on, right? So that's another category. The major category right now would be two more populations, no? Which I guess you are part of. This would be the annual physical exam as well as the pre-employment medical exam, right?
Mm.
Especially the last one, the pre-employment, especially for OFWs who are
Yes.
seafarers, land-based, right? Sobrang hassle niyan to a lot, especially to our yung mga marino natin. Isipin mo na lang kung gaano karami yun, di ba? Ang sinabi ng Europe, something like 500,000 Filipinos were sea-based OFWs, di ba? Na kanilang minomonitor. Tapos yung sa land-based, mas marami pa yon. So, we have that, and then that needs to happen every year, di ba? So isipin mo na lang na yung hassle na yung again pen and paper tapos kailangan babalik-balik ka, isipin mo pag per hour yung sweldo mo tapos kailangan bumalik ka pa ng hospital, bumalik ka pa ng clinic para lang po yung results mo, di ba? Yung kikitain mo wala na.
Yes, actually, when I think about it now, parang in the larger picture of the medical ecosystem, usually, so like we have the doctors, we have the consultations, pero meron yung parang routinary operations. Ito yung parang routinary operations na usually you do it every year or every so often, or for
Yes.
example, if you're on OFW and you have to take an exam, like yung pagkuha ng dugo, pag-test ng mga kung ano-anong likido sa katawan. And ito actually, I mean usually we I mean as like as just a patient, or like like going to an exam, going to a clinic or to a lab. Sometimes kumbaga we underrate these things na usually we just go to the doctor, we just want the doctor. Pero kung tutuusin, ito yung nagte-take up ng time and actually ng manpower na talagang kailangang pagtuunan ng pansin when you want to fix um the medical industry. Kasi when I was applying for dito sa Taiwan, so ang dami kong kasabay ng OFWs, and halata na yung parang stress and parang ang sungit na nga ng mga lab technicians, ng mga tao doon sa clinics, kasi sobrang dami na ginagawa. And it's true na ang laking bagay na magagawa ng automation, or like when you don't have to do these things repeatedly. So it will also save time for them, it will also save stress for them. But in the platform, or like in the Dashlabs.ai platform, so you partner with clinics, with labs. So how does this work? So they partner up with you and they can use their platform. And the reason I'm asking is, like, if I'm someone who wants to take an exam, can I only take my information dun sa mga partners ni Dashlabs.ai, or can I take it anywhere?
Depends, no? So sa under Philippine law, right? The data subject is the data owner, right?
Mm.
So therefore, if for example, data subject is has a request to get all of his or her information that's on Dash Labs that's being used by a clinic or a hospital, right? Because the personal information controller, right, is the clinic or the hospital. As long as they say that, hey, we need to provide this to the data subject, then yeah, we'll provide all the tools necessary to be able to do that as the personal information processor.
Wow, wow. Okay, yeah, yeah. It's very nice. So now, I mean, it's very obvious. I mean, how this speed things up in the
Mm.
medical in the diagnostic labs. In under 2.5 years, so Dashlabs AI is actually a COVID-19 baby, a COVID-19 startup. You have achieved more than 7.5 million tests that have been processed under Dashlabs AI platform. 1.5 million vaccinations facilitated and more than 5 million patients served. So it's very, kumbaga these numbers are like, wow, wow. So how do you think were you able to like do this? I mean, how were you able to like reach these numbers at a very quick time? So what do you think?
It was really partnerships. It was really good work. Sabi nga nila, 'di ba? Good work begets more work, right?
Mm.
So I guess yun nga, the trust of our partners and our clients na nakita nila, uy, okay itong system na to, okay yung yung pagka bilis, mas marami tayong masiserve, mas marami tayong masisilbihan na mga pasyente. So yun, so they decided to onboard and therefore to expand. Kasi ang model niyan is sometimes, like for example, di ba, some of our labs started off as COVID labs as well, and then they slowly shifted. Either they slowly shifted or they refocus their focus back to the general diagnostics part. No, so given that, then as their partner and not as just their provider, we basically moved with their flow, di ba? So yung una, some of the labs tinap lang kami for their COVID testing, pero ngayon nagmo-move na towards yan yung mga general diagnostics, and then karamihan nagmo-move towards yung mga APE and PEME in such a way that they would be able to serve a more solid market.
I see. So from COVID vaccination to diagnostics and now to this physical this physical.
Yes. So naka-ano kasi siya. So ang maganda dun sa APE PEME is that we have this thing called site operations, where it's really very portable in a sense na you can even have your annual physical exam in the office. You don't have to go to this different clinics. And then inside the office, may mga stations na yan. Tapos automatic itatag na yung mga samples, automatic yung collection, naka-organized na ganun.
Yeah, can we know lang some of these like some of these partners if it's okay to say like some of these maybe even the early adopters ni ng product ni Dashlabs. I mean, we started with PRC with
Sure.
this organization, but like can we just know like some of the other partners? Maybe is it possible?
Yeah, sure, no problem. We actually have published them on our website. No, if you look at them, the list of clients are there. So some of them early adopters would be Kairos Diagnostics. They started off as a COVID lab and now they're doing general diagnostics. You have Shalom, which is based in Batangas, where as you know, Batangas is a major port, right, for a lot of seafarers. And then we would also have High Precision Diagnostics, which is
Wow,
quite a
yeah.
major
Yes, and I already
player
take
in the industry.
my diagnostics there.
Mm, diba? And then we have Exact Check, where if you actually go into the Chinese Filipino community, a lot of them go for Exact Check, right? And then we're also partnered with Reliance United, which is the the diagnostics and clinic arm of Unilab, right? So dun sa yung Reliance United, meron silang network of clinics called Health First. So yun, that's nationwide as well. Ang maganda sa kanila is that ang nagustuhan nila is, for example, you go to a Health First clinic in Mandaluyong, in Greenfield, for example, in their area. And then you have a business trip in Cebu. Knock on wood, may nangyari. They would be able to consolidate the data that you have in Metro Manila and then in Cebu and then merge it together to be able to actually easily diagnose you and address your problem immediately, right? So
Yes,
yun.
and actually, for like for example, for high precision, because like this labs, they also partner with other like kumbaga where they supply their lab services. So
Yeah,
when you become a partner, that's a very nice thing you've said. Like the difference with the partner and the provider. If you're a partner and you actually like grow, you actually like expand with your partner,
yeah,
mag-expand din yung nire-reach ni Dash Labs. So I think that's how kumbaga yung expansion ng reach ni Dash Labs nangyari.
yes,
Partnering up with these clients, with these partners, and then their partners are automatically served by Dash Labs.
correct. It
And for
always has
me,
to be collaboration. I mean, healthcare and medicine, at the end of the day, you're talking about saving lives. You're talking about improving quality of life, right?
mm.
There's no sense to do dog eat dog first.
And I think dapat lang na like sa medical ecosystem ng Pilipinas, ma-integrate na yung mga silos, yung mga magkakahiwalay kumbaga na bodies. So more cooperation, more collaboration, and sharing of information para nga mas efficient, especially on the side of patients, of the people who need these services. Before I miss lang, Dashlabs.ai, so medyo may focus talaga sa AI. Baka meron pa other things that like AI is being used in the platform. Baka I mean, aside from automation, are there other AI applications or functions or features dito sa kay Dash Labs?
Sure. So a lot of our AI stuff are still ano no in the, I guess, in the R&D side
Mhm.
of our team. The reason being is that again, you have to go to ano to reality, right, in the Philippines. It's one thing to so it's really a toss up, diba? It was really a choice between are we gonna play around with AI because it's super exciting. You have a lot of these developments, or do you want to address real world problems here and now, right? So I guess what we did was to do both, right? In the sense na you play around with nice and shiny stuff that's on the side. If my implement, if my interested, maybe we could introduce. But the core, the day to day, really needs to be addressing the here and now, because again, at the end of the day, ang ano ba kailangan ng mga clients? Ano ba kailangan ng mga pasyente? Ano ba kailangan ng mga doctors? Ano ba kailangan ng mga partners, 'di ba? Kasi if you focus on what's again, what's shiny, right? You'll never find product market fit, right?
Yeah. At the end of the day, hindi naman AI, hindi naman advancements sa AI knowledge, sa AI tech ang kailangan ng mga tao, kundi yung servisyo, kundi yung lab, yung exam, yung
Correct,
diagnosis, yung
exactly.
vaccine.
Yes.
Yeah, so AI tech, I mean AI is, I mean just like it's like something you attach to your product or to your service to improve it more and to better serve kumbaga yung market or yung people that
Yeah.
you're really serving or helping. Thank you, Martin, for sharing all of this. I'm really amazed actually with how you've kumbaga shared first of all yung journey ni Dash Labs, and especially how you're helping automating labs and clinics and diagnostic labs nga dito sa Pilipinas. But you mentioned kanina that you started as a volunteer organization. So can we know about your background? I mean, and how did you learn about tech? How did you learn about the medical industry? So medyo balik lang tayo ng onte before starting Dash Labs. How did it happen?
Uh so myself and my co-founders were actually not from tech at
Hmm.
all. So my co-founders were my former students.
Hmm.
Uh yeah, so we're mostly from Xavier School
Hmm.
in Green Hills. And then what happened was that our CTO and co-founder Weston, his dad needed to purchase some supplies for the home because of the lockdown. So what they were doing with his classmates at the time was they were plotting and screenshotting like Google Maps.
Hmm.
Um, Tapos sabi nila, parang hindi to efficient. Sige, gawa tayo ng isang Google Maps na platform na based out of yung mga locations na open establishments ganun. Tapos yun, so from there, ang nangyari is napansin kami ng mga we reached out to more people who wanted to help who kasi like for example myself, I used to run innovation labs, right? And I used to have um several very very talented mentees and students, and a lot of them were very interested to help out because wala, nasa bahay lang naman sila at that time, di ba? So they said, hey, I want to help. I want to, do this. So yun. So, and then what happened was that one day, Google, a representative from Google Philippines actually, for some reason, they chatted the platform. Nung una, hindi ko, ako pa yung nag-respond. Hindi ako makapaniwala na taga-Google yung nag-inquire. Syempre, makilala naman ako from okay, so I verified, totoo naman pala. So yun, they offered support, and that was very instrumental in growing the platform, and being able to say that, hey, we're serious about this. And then yun, dun sa nag-start yung sa medical side, when again it started from when we were looking at the industrial engineering process of of the Red Cross and the overall national COVID testing. And then from there, sabi namin, at the end of the day, a process is a process, regardless if it's medical or technical or computational. And then we mapped it out, and then we essentially applied operations research on it, and then yun.
And sorry, you were teaching which program, which course, which subject?
I was running the innovation lab in Xavier back then. So lahat yun, from competitive programming to robotics to technopreneurship, yeah.
Yeah, but you mentioned kasi medyo naglight yung aking apoy when you mentioned industrial engineering processes operations research. I'm actually from the University of the Philippines. I'm actually a faculty sa IE/OR, sa industrial engineering.
Oh, UPD-IEOR.
Ito din actually yung ginagawa ng mga students sa department na processes. I mean, basically, when I was a student, not just documenting, but also like finding the inefficiencies, finding the ways on how you can like improve the process, make it faster, remove all the waste, find the bottleneck, and improve the bottleneck. So I'm
Correct.
obsessed with all of these things, process improvement. So ito yung parang so and it's true na ang laki ng magagawa pa nito. Siguro right now there have been a lot of parang impact sa medical industry pero ang dami pang pwedeng gawin. Sobrang dami pang pwedeng gawin. Ang lawak pa nito at ang dami pa nating kumbaga proseso na mapapabilis at in the end mga buhay na maisasalba at mga buhay na ma-improve quality of life kumbaga na matutulungan.
Completely agree. We actually have I'm not sure if you're familiar, but we actually have an MOA with Dashlabs has an MOA with UPD-IEOR.
Right now,
Where yes, existing, and then so we do get interns from your department, and then so baby project sila sometimes where tinitingnan nila ang certain specific processes, tapos ini-improve nila yung mga yon. So maraming malaking tulong.
I see. Right now kasi I'm remote, so hindi na ako ganun. I'm not full time, so mas alam ito. I will ask them. I will ask actually yung mga faculty right now. I think I know who. Kasi ito yung subjects maybe na parang that deals with process improvement, with systems and procedures, methods engineering. So yeah, I think that's it.
And you know what I really like about hindi sa pagbubuhat ng sarili bangko or anything, but what I really like about UPD students is that hindi sila takot na to go to the trenches, di ba? To actually get their hands dirty, to really understand what the processes are. Kasi kumpara sa ibang mga nag-aaral sa ibang mga pamantasan, di ba? A lot of them are, ay, sorry, hindi ako pwede pumunta sa let's say sa port area ng Navotas, yung mga ganon, or kung hindi sa Tondo, mga ganon.
But actually, I think yun yung gusto nila kasi gusto nila ng I'm not sure, but I mean I cannot speak for all of the students of course. Pero I think most of them parang they're hungry to experience the real, I mean, to really go to the community, to really go to those people that they want to help, to really understand. I think they're hungry for that. Part din yung kumbaga nang nai-instill ng university sa mga students. Yung parang, if you really want to help these people, you have to go. Hindi pwedeng you're just from afar. You really have to be with them, to really integrate with them, to not just understand, to not just know, but like to also understand. And because with understanding the problem, we say nga that you already solved the problem if you have like if you know, or you've already solved 50% of the problem if you already like stated it properly. So that's a big part, like yung understanding. But let me ask
Agree.
you, Martin naman. So ito yung medyo parang yung parang drive ng mga students. But for you, for Dash Labs, what's your drive? What's your motivation on keeping on building this, on keeping expanding the reach, keeping on growing Dash Labs? So parang what's your drive? What's your
I think it's really because you see the result, no? You see the effect of the work that you're doing, right? If you again, if you go to our website, we do have some videos of some of the people who benefited from using Dash Labs, right?
yes, yes.
These would range from OFWs to pay normal patients with families to doctors to lab owners. And these are just snapshots. Our email inbox is filled with these stories, right?
Mm.
They people do write in na yun kunwari imbes na before it would take them 1 week to know that they have I don't know a certain condition, right? Right now it would just take them let's say a few minutes and then ma-diagnose agad, ma-address agad and because of that, they don't have to go through a certain regimen anymore.
Actually, yan ang isa sa mga profit na nakukuha as a startup founder. Hindi man monetary, pero I'm sure there's also like monetary benefits, I mean monetary gains. Pero like yung actual na nakikita mo that your product, your that thing that you've built did something for other people. I think that's actually priceless.
Hmm.
Let me ask you this, Martin. So you've been building Dash Labs. Actually, it's very awesome what you've built. So, can you share like the greatest lesson you have learned so far in your journey from COVID-19 to now? I mean, from that COVID-19 time when you started Dash Labs. Parang maybe share the greatest lesson na maaaring makapulutan ng mga nakikinig nito ng episode na ito from your startup journey. So yeah, can you just share?
I guess we go back to no to your question about to toss up between going for what's lucrative or what's here and now, what's right there, right? You can again you can still do both, but your focus needs to be on the right here right now. And always listen to your stakeholders, always partner with your clients, with your with the people that you work with in the field, in the industry, in the environment. At the end of the day, kung wala sila, wala ka rin, di ba? So at the end of the day, pareho naman yung mission ninyo to really help people, to really help clients more. Of course, you have to balance it with reality as well. The tipong hindi ka pwedeng magpatakbo ng isang business na palugi, 'di ba? Maybe at the start pwede konti donation ng konti ganun just to get a foothold, but you have to run a sustainable business in order for you to be able to help even more people.
Wow, that's a very good line. Run a sustainable business in order to help people sustainably.
Yes, correct.
Yeah, maraming salamat Martin for this conversation. Just one last question. Ano nga ba ang vision talaga ni Dash Labs? I mean, what do you see pa in the future? What's your plans moving forward? So maybe pa-share lang ng pahapiaw lang ng mga gagawin pa ni Dash Labs para aabangan namin.
Sure. So I guess two things, no? So number one is really improving the quality of healthcare. in the country through digitization, through automation of processes. And then the second one is to be able to share these experiences with other countries as well, especially our neighbors, especially those who share in similar demographics with the Philippines, right? The emerging countries, those two who actually are in most need. Because again, as you know, ang layo the difference between rich countries and poor countries, 'di ba? In Taiwan, as you said, you have all access to all these at an instant. Because you have the proper processes, you have the proper funding, you have the proper environment, and the proper policies to be able to actually implement and drive these things, right? In countries like the Philippines, in countries like, let's say, East Timor, even countries in the continent of Africa, right? You wouldn't have the luxury of these. So therefore, it's really public-private partnership that would drive these improvements and efforts.
And actually, like here in Taiwan nga, ang dami dito, actually, hindi ka ganun karami yung Filipino migrant workers dito. Yung pinakamarami dito is Vietnamese and Indonesian. So I think may opportunity din dun for like, kumbaga we share the same market because ang dami din dong OFWs na magte-take ng exams, mga ngailangan ng mga diagnostic exams na ito, ng mga lab exams na ito, ng mga lab tests na ito. So I think there's very great room for kumbaga expansion of Dashlabs. Thank you, Martin. If our listeners want to know more pala, how can they find more information? Maybe you can just lead them to the website or to your social media channels if you want. So if they just want to connect with you or maybe contact you, so how can they know more?
So our website is www.dashlabs.ai. Yung sa social media, we have some posts there. But I guess a lot of the posts were during the COVID times where we wanted to update a lot of people with what was happening, and medyo nag-load lay low kami dun sa pag-post sa SOCMED kasi at the end of the day, again, yung channels namin is through the existing labs and partners, no? But if they want to know more, they could definitely email me. My email is martin@dashlabs.ai. Feel free. Yeah, we're more than happy to partner with even more institutions and even more people to really improve healthcare in the country.
Yeah, because the Dashlabs pala is actually more of B2B, so like partnering
Yes.
really with other businesses. So anyway, go to dashlabs.ai if you want to know more. And maraming salamat, Martin, for this conversation. Thank you.
Thank you very much to our 32 patrons. This episode is super powered by TechShake, Asia's most active Philippine-based startup ecosystem builder creating bridges with investors, corporations, and governments. 1 CFO, tech-enabled CFO, bookkeeping, and tax services for startups and SMEs. Take 5 Outdoors, the best guided outdoor adventure tour in the Philippines. They specialize in hiking and mountaineering trips. Benjoy's Food Products, the home of premium bacon ends, tapa, and tocino. D-Buzz, Web3 microblogging app promoting freedom of speech and content ownership. Pinoy IP Works, capture your startup's value proposition through patent and trademark protection. Packetworks, the leading enabler and only Internet of Things social enterprise in the Philippines. Looking for buy and sell online with Sigurado sellers. And NutriCoach, the all-in-one productivity tool for dietitians and nutritionists. This episode is powered by Pareto Consulting, AltSwitch, ePlayment, Tuala, and Hive Energy PH. AskLex PH Academy is our official e-learning partner. Get certifications on Lean Six Sigma, project management, data science, and many more. Support the podcast through the links in the description.